Hello everyone, welcome to my channel A to Z Nursing Notes, and I am Rupinder, and in this video I will be talking about the new language proficiency policy that is coming up with the College of Nurses of Ontario. So this new policy, it will be coming into effect on 7th March 2022, and it is applicable to those applicants who will submit their language proficiency on or after this date. But if you are submitting your language proficiency information before this date, then you will be evaluated according to the current language requirement policy. So what is the existing policy for language requirement? That is how you can meet the language requirement for the NNAS or the College of Nurses of Ontario. So there are basically 4 methods by which you can prove your proficiency in the language, that is English and French. The first one is by completing a nursing program, that is either a practical nursing program or a bachelor's nursing program or a nurse practitioner program in Ontario, Canada or any other jurisdiction. But the conditions are that the theory and the clinical instruction was provided in English or French in that institute. The primary language of the educational institute was English or French. The program was not an online or a distance education program. It should be in person or a campus program. The theory and the clinical instruction was not completed exclusively through the PLAR, that is a prior learning assessment and recognition method. So whichever nursing program you are taking, they should follow these conditions in order that your language requirement is met by College of Nurses of Ontario. The other method is by holding a current registration with the college within the last, or if you have held the registration with the college within the last 2 years in any of the category, that is the general, temporary, extended or special assignment classes. Another way is by holding the current registration with another nursing regulatory body in another province of Canada. That is, if you are outside Ontario and you are registered with any of the other provinces, then also you meet the language requirements, or if you have already held registration within the past 2 years. The last method is by achieving the required benchmark scores in one of the language proficiency tests approved by the College of Nurses of Ontario. I have made a video on the language requirements for NNAS in which I have discussed about the tests and the band scores in detail. I have given the link of that video in the description box. Now once this new policy comes into effect, there will be 7 different ways in which you can demonstrate your proficiency in English or in French. That is, you have your options have increased to prove your language proficiency. But in case you are not able to meet your language proficiency through these options, you still have the last option of giving the approved language proficiency test and achieving the required band score to satisfy the band requirements. So the first option for you is through registration. That is, if you are working as a registered nurse in any of the Canadian jurisdiction, that is in any Canadian province, you already meet the criteria of language requirement. The second option is that you have done some education in the past 2 years, which is either in English or in French. In this way also you can meet your language criteria. So in this case, you must have completed an approved nursing education program in English or in French with a clinical component in any jurisdiction of Canada. So the clinical component, it is very, very important because you will be demonstrating your abilities to communicate effectively with the patients, and this way you are able to meet your language requirements. Another is you have completed a healthcare or a healthcare support program in English or French, again with a clinical component and in Canada. Another way is you have completed an additional nursing education course in English or in French with the clinical components. So you must keep in mind whichever educational course you are taking, either in the nursing field or in related to nursing field course, you should have a clinical component with it so that you are able to meet the language requirements. Another option given for you is through if you are having some past experience, work experience in the past 2 years, and you have practice experience as a nurse in predominantly English or French setting, like if you were working in, suppose, Alberta, right? So you are having your experience as a nurse then you can show your experience to the CNO, and that you can meet your language requirement in this way. Another way is you have an experience working in the healthcare setting, providing services in English or French in Canada. This criteria you can meet with the new upcoming program, that is the Supervised Practice Experience Partnership Program, that is the College of Nurses is coming in collaboration with the Ministry of Health of Ontario, and I have just discussed in detail about this program in my previous video, that is Ontario to move nursing applicants into healthcare system. And the last and the most common option again is the language test. You must achieve successful results in one of the CNO's approved language proficiency tests like IELTS, CELBAN or TEF. And in this way you can show your proficiency in the language, and you can meet your language test requirements for becoming a registered practical nurse or a registered nurse in Ontario. For more updates, subscribe to my channel. Thank you very much and all the very best.